This is Inside Indiana Business Radio for Tuesday, November 26th, 2024. I'm Mark Mazurik. Terre Haute-based Union Health has withdrawn its application related to its planned acquisition of Terre Haute Regional Hospital, the health system said Monday. However, Union Health has said the two parties will continue to work towards completing the deal, though an estimated timeline was not given. Plans for the acquisition were first announced last fall, but the measure soon drew opposition from the Federal Trade Commission this September. In a letter opposing the merger, the FTC said the combined health system would have a share of nearly 74% of all hospital services in the region. That meant a, quote, substantial risk of higher costs for patients. Union Health said in a statement Monday that it felt it was best to withdraw its application, but it will continue to work with Terre Haute Regional Hospital and the Indiana Department of Health and review the acquisition. The FTC did not respond to requests for interviews from Inside Indiana Business. Earlier this month, Fort Wayne officials flipped the switch on what it calls its new microgrid system, which highlights complex new technology that put the city on the cutting edge of energy usage. The system draws on a newly completed floating solar panel array, biogas, and natural gas to power the city's filtration plant, water pollution plant, and weather pump station. City Utilities Deputy Director Matthew Wirtz said the grid lets the utility switch between different energy sources depending on which is most cost-effective in real time. It also makes the grid self-sufficient, which was a big goal for the utility.
So we can now use the emergency generators to power everything if we need to. We can use the solar to power both plants and the pump station, and then we can use the methane generators at the wastewater plant to power all three facilities as well. So we have extremely high reliability now.
The project cost a little over $24 million, and $10 million of that went towards the solar panels. If the price of natural gas continues to go up, the microgrid system could save the city from paying $8 to $10 million in energy costs over the first 20 years of use. The concept of a floating solar panel array is rare, and Fort Wayne's is actually the second largest in the country. From the number one source for Indiana business news, this is Inside Indiana Business Radio.
Central Indiana, your bold future starts here. IBJ Media, Inside Indiana Business, and the IEDC invite you to Engage Central Indiana, December 12th in Indianapolis, presented by CareSource, Indiana University, and Old National Bank. Join us for a day focused on Central Indiana's growth. Connect with fellow leaders and walk away with bold new thinking to help your region thrive. RSVP now at ibj.com/engage.
Ratepayer advocates are celebrating a Friday settlement with three of the state's largest incoming data centers in Indiana Michigan Power, touting new projections for Hoosier bills and the state's electricity supply. Major new data centers from Amazon Web Services in New Carlisle and Google in Fort Wayne both need plenty of power from I&M. Also included in the settlement was Microsoft, which has announced a $1 billion data center in LaPorte. The three data center signatories agreed to each provide $500,000 annually for 5 years to the Indiana Community Action Association. The money will support low-income Hoosier customers for efforts such as weatherization. The agreement also sets out a new contract, payment, and other requirements, but its terms don't stop there. If state regulators approve the non-discriminatory settlement, it'll also apply to new industrial customers with large electrical loads. That's defined in the contract as companies that use 150 megawatts or more of total energy. And shares of Eli Lilly and Company surged Tuesday after news of a Biden administration proposal that Medicare or Medicaid could cover the cost of weight loss drugs for millions of Americans. Lilly shares had spiked about 5% to $795 by midday Tuesday. The costly proposal from the U.S. Department of Health and Human Services sets the stage for a potential showdown between the powerful pharmaceutical industry and Robert Kennedy Jr., an outspoken opponent of the weight loss drugs, who, as President-elect Donald Trump's nominee to lead the agency, could try to block the measure. While the rule would give millions of people access to weekly injectables that have helped many shed pounds very quickly, it would cost taxpayers as much as $35 billion over the next decade. A bipartisan coalition of congressional members have lobbied for the drugs to be covered by Medicare, saying it could save the government from spending billions on treating chronic ailments that stem from obesity. While it's unclear where Trump himself stands on coverage of the weight loss drugs, his allies and cabinet picks who have vowed to cut government spending could balk at that upfront price tag. The leader of a nonprofit looking to break the cycle of poverty in Indianapolis, Shepherd Community Center CEO Jay Height is this week's guest on the Business and Beyond podcast hosted by Gary Dick, presented by PNC. A weekly conversation with high-profile Hoosiers in business, sports, entertainment, and beyond. Available now from your favorite podcast provider. I'm Marek Mazurek for Inside Indiana Business Radio On Demand.